Uh, Hi guys, hope you're doing great. So let's get started for this quick session. The objective would be to sensitize you to these questions that have been asked, so I can have a quick feedback from you guys with respect to whether the audio and the visual part is fine, and then we can get started. I mean, I have questions lined up, and what we do is we do a quick analysis of those questions in the shortest possible time frame. Okay, so I'll just give me a second. Sometimes you can be having some teething trouble as well. So that's what I am encountering at the moment. Hopefully would be able to fix it in a few seconds from now. Fine. So we're good to go. I think the very first question that lines up is regarding from physiology. This was regarding the most stable and the long-term mechanism of homeostasis in human body. And two close options were SpO2 and then urine output. The bottom line is that when you talk about SpO2, it can be varied by multiple factors, including like the finger on which you are putting the pulse oximeter. But one thing that would not be affected is the urine output. So we'll go with option number B for the first question that is currently on the screen before you. And why at this point of time? Because I had a class, man, and I had to finish it off. And after that, I came for this. So that's why a little delayed. Okay, the second one was regarding a transport system. So I know there are two questions. One in pharmacology with respect to, where digoxin would be acting. There also ATP was written, and here also ATP is written. But yeah, this is not gonna be sodium potassium ATPase. The answer to this is P glycoprotein. Has been discussed by multiple faculties, but I just wanted to say that in a single paper, you cannot expect two questions on sodium potassium ATPase. So one was on digoxin and the second one is the one that you can see at the moment. So this is C. Let's move to the next one. I discussed a couple of graphs just 1 or 2 days before the exam. I think just one day before exam, if I recall, where we spoke about the changes in the pressure volume loops with respect to mitral stenosis, aortic stenosis, etc. And then, like, if the loop is going up here, that means the afterload is increased. So we are thinking in terms of valvular aortic stenosis, and therefore we will go with the not increase venous return, man. I mean, the afterload part is increasing, no, because the graph is going up here. So we'll go with the increased peripheral vascular resistance. That is one possibility, because that is how the options were framed. Otherwise, the bottom line is I would have gone with a left ventricular outflow tract obstruction. But yeah, I mean, if he has given the hints in inside out, then it goes much more advantageous to us. But I think based on the fact that there is an afterload increase and the curve is going upwards and slightly to the left, we have to think in terms of problems with the opening of the aortic valve, which is why the answer to this is option number B. Then is very classical. I always say this in my medicine discussions: systolic blood pressure falls during normal inspiration. Now, like, why does it happen? Because you are having more blood supply to the right side of the heart, and all that will go in the lungs, and pulmonary compliance improves. So because the pulmonary blood vessels will dilate, therefore the blood supply to the left side of the heart will become relatively lesser. So if you look at the options here, it is, I mean, pulmonary compliance is going out, systemic vascular resistance part goes out. It's between left ventricular filling, which is written to be increased, right? It's gonna be lesser rather. So the plausible explanation is that there is an increased venous return to the right heart. As I said, negative pressure causes more blood to come in, and that would result in like the increase of pulmonary compliance. And as a result of it, because pulmonary blood vessels are dilated, so the blood supply coming to the left side of the heart will become relatively lesser. So I think we are sorted for the fourth one on the agenda as well. Yeah, this was a difficult one, guys. I agree. I mean, the physiology part, suppose this question was based on pulsus paradoxus, all of you would have been like super, you would have grabbed that opportunity, right? But then he did not ask about definition of pulsus paradoxus. He went into very basic data. So it requires a bit of like, a logical analysis to be done. Though I always talk about murmurs and I always talk about impact on the respiration on the same. Okay, so moving to the next one, which was a fact-based one for leptin resistance. I mean, the person will obviously be having obesity. So we are talking about arcuate nucleus in this case with respect to the hypothalamus. Uh, yeah, one-liner in my opinion is much more difficult as compared to, I can say, the long stem questions. This is a easy one. I mean, the part of the brain scanning the visual field, that would be the frontal eye field. No, like patient is having seizures related to the frontal lobe. Then you'll notice versive, that is deviation of eyes towards one both sides. So like the frontal lobe part is relatively easy for us to comprehend in this case. The answer in this case is decreased left ventricular filling. Okay. Doctor, I could not pick up a decreased ventricular filling there. It was an increased left ventricular filling, and I mean, if I increase the endostolic volume, then you know what happens. I mean, then the systolic blood pressure should be increasing, right? It would not be decreasing. So that is why I think it's all a game of increase versus decrease only. But considering the options that I could collect, this makes a much more plausible explanation that I have already said. So at this moment, since this is a recall session, we need to be a little faster. But yeah, I think I have, if you scroll back a little, tried to give the logical reasoning for this one. Okay. Moving to the next one, repetitive nerve stimulation shows a decremental response in myasthenia gravis. Even if you listen to the medicine lecture, I've tried to explain there that agreed that the pathology in this case is going to be like the post-synaptic receptors are blocked, but then there is something called as a pre-synaptic rundown. I mean, I have a snapshot from Harrison also, because I was getting a lot of queries with respect to, like, why did you say that there is going to be a decreased release of acetylcholine from the pre-synaptic terminal? I agree to that. That happens in even a case of Lambert-Eaton syndrome, but in Lambert-Eaton syndrome, we get an incremental response. So this question is primarily based on physiology, and what happens is that the receptors are tired, right? And the receptors are not responding. So the acetylcholine release also tends to decrease. I thinking that in this question he will mention regarding excite EPP, EPP per receptor is gonna be affected, but then there was no option related to that. So the only option that is left here, the feasible one in this case would be, I mean, it's not antibodies blocking the presynaptic channel. That is gonna be classical Lambert-Eaton syndrome, that anti-P by Q antibodies that are present. So what यहाँ पे हो क्या रहा है कि वो थक गए, जो एसिटाइल कोलिन को रिलीज करने वाले वेसिकल्स है, वो कह रहे भाई कितना काम करवाओगे, इतना तो रिलीज कर दिया, फिर भी कोई असर नहीं हो रहा है ना। जैसे होता है ना कि पेरेंट्स हैं, उनका बच्चा जो है वो सुनता नहीं है, तो पेरेंट्स कह रहे भाई तुझे कितना बोले यार, तू सुनता ही नहीं है, तेरे कान पे, वो हिंदी में बोलते हैं कान पे जू नहीं रेंगती, समथिंग लाइक दैट, राइट? सो सिमिलरली हियर इन myasthenia gravis, like the acetylcholine vesicles tend to get depleted over a period of time, which is why the answer in this case is option number B. And yeah, I mean, I agree by physiology, the question is on decremental response. Why is it seen? So that's why I put up a reference from Harrison for the same. From the pathophysiology, I agree to the fact that there is decreased receptors at the postsynaptic membrane. I had a chat with the physiology teacher, Dr. Manna also. I mean, he's a legend in this field. And he said, like, that very categorically that it's not going to be like related to the receptors part. It is like why we get a decremental response has been asked. So it goes in favor of option number A. Yeah, I agree. I agree to the fact that, the receptors are the ones which are defective, but then you have a reference from Harrison highlighting this fact here with the page number. So I think we'll go by the textbook data for this one. Then he says, which of the following neurotransmitters is correctly matched? So you are having a mess related to all the informations. I mean, nucleus of basalis minor is related to acetylcholine, and dopamine is like linked to locus coeruleus. So the only thing that is plausible here would be with respect to serotonin, and that would be the raphe nucleus. So the correct answer in this case is option number B. And as far as the options are concerned, like we did a lot of workup on this even yesterday. So I think this would be at this moment more of a issue of closure, I would say. And moving to the ninth one for today, like he says, and yeah, keep the comments coming, guys. Keep the comments coming. Like, I would like to know that I am, I am interacting with you guys at the moment. Okay, so pretty late, but yep, it should be worth it. Okay, so least amount of secretions, least following secretions would be least. Yes, guys, quickly comment with respect to least amount of sodium present. Obviously, that would not be duodenal fluid. So waiting for your answers for this one, guys. Yes. Okay. Yes, that would be saliva. So the correct answer in this case is option number B. And cool. Fine. Next is about magnesium metabolism in the human body. So majority of the magnesium, I mean, is handled by the kidneys, and therefore reabsorption from the kidneys would be the correct answer in this case. I mean, magnesium, majority of this would be intracellular, and then the milieu or the environment of magnesium or the levels of magnesium would be maintained with the help of the kidneys. So the question was most significantly impact on magnesium metabolism, which is why the answer to this question is option number B. So they were like 10 odd questions from physiology, very hardcore. And then biochemistry was 19 MCQs, man. I mean, I was like flabbergasted. 19 MCQs from 19 or 18, whatever from, but they are like, much more than what, or equivalent to what came in, let me say, surgery. So even medicine, the questions were relatively lesser. Okay, Ji. So the crocodile burns would be seen with respect to the electrical injury. So we are like pretty straightforward one. This like I remember from my UG days also, I did not have to break a sweat regarding it. Then is about a patient who's been like it. This is a common thing which is exploited by these under trials, and they want to go to a remand home and not go to a jail. So obviously their lawyer will produce some birth certificate saying that these guys are like younger than 18 years of age, and our role as a doctor is that we are trying to prove them wrong. So we need to do a proper X-ray so that the guy gets the punishment that he deserves. Yeah, the image may not be same, man. Come on. I mean, I cannot replicate the same image, but yeah, I mean the way the description is given, it's much more feasible. Okay. This is going to be the wrist and the medial clavicle and the pelvis, which would help in identification. Then is a sexual assault, which is reported by this 24-year-old lady. I mean, I think it was 18 or much, much older than this. So we don't need a consent like from our mother, consent from the mother, and we can move on. So we are sorted for 13th. Then was gas geyser. I mean, I always speak about gas geyser poisoning, carbon monoxide poisoning most of the time whenever we are discussing like anemic hypoxia occurring in a patient. So we are sorted for this. Then 15th was match the following. This is anyway matched already before you, and therefore this is sorted out. Then not used for detection of seminal stains. So that this would be for heavy metals, right? Range test is for heavy metals, where the answer will turn out to be option number D. Okay, and then is this guy who's having schizophrenia probably, and then he is not gonna be guilty of whatever he has done. I mean, the patient will not be held criminally liable. So, okay, leaf facius sympathetic, the guy would be having eye on that side would be open because because the knot will be pressing on the cervical sympathetic chain. So the correct answer in this case is option number D. That's what's written here. The eye is open. That's because of the Muller's muscle being stimulated by the sympathetic chain primarily. Then is bliss. There were two questions on burns. One I'll discuss in surgery where a hot drink fell on the hand of a person. And second is with respect to a forensic expert, and there's a line of demarcation. Soddening also present. So that would basically be mentioning regarding a moist burn in a patient. So we are sorted for, yeah, cervical sympathetic chain. So keep the comments going for this one, guys. And then match the following for the antidote. This you guys anyway know, even at the middle of the night. If you guys are woken up and asked regarding the outputs, you can work out the answer. Then was a match the following for the delusion. So the grandeur versus the persecution, nihilistic, pretty straightforward. The FMG part was the influence, that is thoughts and actions are controlled by others. This I discussed even in the FMG paper, but yeah, for the remaining ones, yeah, it's just match the following, which have to be remembered. Then is a neural malignant syndrome. So we give dantrolene sodium on that. So I already did the marking for the question. Then is a patient who is having like neurologically, neurological symptoms, paralysis ho gaya, a person cannot see properly, blindness occurring in a patient. That's all astasia, abasia. That's la bella indifference that we always read about. That would be with respect to a conversion disorder. Very straightforward, though nowadays the conversion disorder is like an outdated terminology, but still they decided to persist with that. And then the references for the same from the notes are already shown here. Then was a very interesting question that you have to work out by exclusion. I mean, there was no, torturing pets and bullying other kids. There was no opposition to the principal or the parents, and there was no ADHD manifestation. So this was a disruptive mood regulation disorder, and our faculty has already discussed that in the routine ones also. Then is this guy, I mean, he is getting sexual gratification by inanimate objects. So that's pretty straightforward, the fetish part here. And now we focus on the obligate intracellular organisms. Obligate intracellular for here would be two close options, Tropherma vipili and Ehrlichia. Tropherma vipili can live even outside and even inside the macrophages, but Ehrlichia is like typical anaplasma Ehrlichia whenever you study the obligate intracellular organisms. So it would be C. Then his Thornprick injury, he put up an all except question. Normally, like they put on that Rose Gardner disease, but this was like an all except. So you have to work out on the basis of mnemonics, or even without that. Dermatophytosis is like more of Indian disease where there's going to be like sweaty and humid atmosphere contributing to dermatophytosis. Then is the commonest cause of diarrhea in adult population, which would be answered as norovirus. This you have to work out on exclusion. I mean, rotavirus is going to be, or adenovirus is mainly going to be infantile diarrhea. So 28 is sorted. Wucheria bancrofti कहाँ पे घुस जाते हैं? So you always read about the term tropical pulmonary eosinophilia. That is, they would be migrating to the lungs of the patient when they're not going to be present in the bloodstream, but at night they'll come in the bloodstream. So the question was with respect to, like, where they are going to go into an hiding, and you read about that bilateral infiltrates in a chest x-ray with the eosinophilia. And we are a tropical country, so that's why we need to be ready for it. Then is that classical, I mean, that germ tube appearance that we come across with Candida albicans. So this is like a Raynaud's brood phenomenon that they teach you. So pretty straightforward for 30th one. Then was black granules that are coming out of this beggar's foot. The moment you read about black granules, you know your Madura foot, and Madura foot would be Madurella in this particular case. As far as the remaining ones are concerned, Staph aureus, they would be pus present. So this is not botromycosis. The image is totally different from what initially was being propagated, because botromycosis would be a pus discharge that would be present. So 31st is sorted. Then was that lid wala, he is, I think himself mentioned operculated crab, seafood. तो मतलब INI-CET पेपर के बाद में तो सी फूड से आई थिंक डर लगना शुरू हो जाता है, बिकॉज देयर वाज क्वेश्चन रिलेटेड टू क्लोनॉर्चिस एंड देन देयर इज अनदर वन ऑन पैरागोनिमस वेस्टर्मनाई. So what we are going to do in this case is, because there's hemoptysis given Indian population after seafood, then we have to think in terms of Paragonimus westermani as an answer and praziquantel as an answer. Then was strawberry cervix for Trichomonas vaginalis. So sometimes you wonder whether is it the same set of examiner who's asking the questions. True regarding virus in the image. So I think this was regarding that I think human papilloma virus and there are two ways the question was asked. I think the images are, there's another image that I've also put up in the later part, but then we have a vaccine. We don't have a painful genital ulcer in this case. So this would be an oncogenic virus. So I think the option number B can be picked up here. Then is that egg of either, I mean, that huge, round lobulated appearance that we read with Encyclostoma negator americanus. Okay. Question in the image. Yeah, this one I cannot replicate the image, but yeah, for this one, this is standard CDC data. I mean, for those of you who ever found parasitology difficult, I think my opinion would be just if you go through the CDC website, things will become easier for you. Then is this exophytic valvular regions that we come across, and then this branching at a 45-degree angle is present. That would be aspergillus. Initially, I thought it could be Candida as well, but then the gomorimethamine stain, the green background is present. And these are like standard questions in the app in the QBank that you'll be coming across. Then is match the following for this. So swimmer's itch is for schistosomiasis. That is relatively easier for you to wake up. And then the remaining ones also I think are pretty straightforward. So I'll not get into that matching part because the options have already been taken care of. So we just had to take care of the last option, which was the one that was missing. That was schistosomiasis. So I think we are sorted for 37 also. I mean, I don't need to get into talking about cutaneous larva migrans and cyclostoma brasiliensis in the remaining aspects. Okay. Next was a patient having productive cough with a rusty sputum. That itself is a clinical hint for possibility of pneumococcus. And then there are like these diplococci that can be seen. Some of them are in groups also, but then diplococci can be seen. And we always read about bile solubility, insulin fermenter, and the noptocene sensitivity. So if we look at the data here, I mean, the only thing that fits the bill for pneumococcus is bile solubility test. So traditional data, I mean, pneumococcus for lobar pneumonia, either you'll get into curve 65 or you'll get into the microbiological details, but pneumococcus would always be a part and parcel of the discussion. Biosafety level 3 for Mycobacterium TB. Then was an image that I always show in my routine class, Nipah virus. I think that was relatively easy. Encephalitis is the cause of death here. Case fatality ratio documented is 40 to 65%, and it's like the bats that would act like a reservoir. They call them T-ropus basically. So 40 is sorted. Then was regarding this EF2 toxin, I think there was an image or maybe the name was given, and then he said what is correct about them, multiple correct. So diphtheria toxin, if we are talking about myocarditis, makes sense. We'll give diphtheria antitoxin to the patient, and the remaining two options are the wrong ones here. So depending on the whether he asks the correct one or the wrong one, we can work out the data. Then is high tissue inflammation with suture material. That would be catgut. I mean, that would be like, having a very, I mean, you would have seen in government hospitals, whenever you, if catgut is being used, you get a very severe reaction present. So that's like easily identifiable that the catgut was used. Then is working ports in a laparoscopic surgery. That's manipulation angle. Azimuth angle, I think they have already spoken about, was one of the previous year questions, and this time they talked about manipulation angle. Okay. Then is arrange the steps of surgery. This I could also solve in the very first go. Pneumoperitoneum, then is dissection, then is gonna be ligation, and then is separation of the gallbladder from the liver bed. So I mean, for this, I think we just needed presence of mind. No special surgery studies were required. Then is a wrong statement. We have colostomy that is gonna be flush, and here the colostomy like is mentioned everted above the skin level, which is why like 45 the answer for this will turn out to be for the wrong statement as option number C. Okay, then is late dumping syndrome versus early dumping syndrome. So when you look at the manifestations, late dumping, first hyperglycemia, insulin release, then there's gonna be a reactive hypoglycemia. So positional part, the lying down part would not be helping in this particular case. Everything else makes sense for late dumping. He said wrong statement about this. So the answer would be option number C. Okay, then depending on the image, some guys said that they could see the Taenia coli and then they could see the appendix. So if you were like having that good view of the fact that there were Taenia coli present, and then at the same time even like the appendix visualized, then we'll say it would be MA and hernia. But if it is anti-mesenteric border, then it will become Litter's hernia. So any of the two possibilities can be there. The first image is for Litton's hernia. The second one is where like a much more classical view related to when the appendicectomy is being done, or when this hernia is being operated, the content is being asked, but then the classical appearance of the appendix can be seen on the mesenteric side, whereas the anti-mesenteric border or the anti-mesenteric image makes it easier for us to comprehend. So depending on the image, the answer in this case would be present. Yeah, I agree, Neeraj, the image for this would have been confusing. Then a patient underwent a lab chole, and then there's a lot of drain output, 300 ml at I think day 7 or day 5, whatever. And then there's a cyst jump leak as well. So normally like INI-CET also they had questions on CBD related injuries, and this time he said, what will you do? So most of the time it's going to be inflammation in the cystic duct because of the handling part. So we need to go for a ERCP with or without a stent, depending on if there's like edema present, then that can be relieved. Otherwise, sometimes stone can be passed down into the CBD as well. So that could explain like during the process of surgery, a stone migrating down could also explain like why there is a bile leak happening in a patient. Then was inflammatory carcinoma. This you guys are like, good at. Inflammatory carcinoma, one of the most aggressive breast cancers, neoadjuvant chemo followed by MRM followed by radiotherapy. I mean, that makes sense here. And for the remaining options, like much more, I would say, less aggressive approaches are there. Then was a person who had spilled hot milk on his hand, and there were blisters also present. Considering blisters present, I would say that we'll think it of as a superficial partial thickness burner. Hot drink, milk or a drink, it would not be like, it was not like oil or like pudi is being made or like some pakoras are being made. I mean, then the oil would cause extensive burns, but a hot drink, like I am more comfortable with a superficial partial thickness burn. Figaro classification, I had to look up, that would be chronic pancreatitis. But some of them could be worked out by logic, like the 52nd one, where there is going to be raised mucin. I mean, that he himself is giving a hint. CA is related to anyway the intestinal tumors, and then mucin is elevated to normal amylase. So that goes in favor of a mucinous cystic neoplasm of the pancreas. Okay, even if the blisters are not present, still we'll go with the superficial partial thickness burn, no, because person is spilling a drink on the hand. So I think that we have to give it the least grading from the perspective of that the burn would not be so severe. It's not like oil, burning oil. Like I said, child put hand in a kadhai, and that can result in like extensive burns present. Okay. Next was this gastric ulcers, and then mass found in the second part of the duodenum. So that he did not mention, I think, endoscopic ultrasound, or maybe that was mentioned, but we are talking about a Zollinger lesion, and therefore it is serum gastrin level that would be considered in this case. So 53 down. Let's look at the next one, the procedure. Uh, I mean, there are two images that people were fighting about. Pritesh Boss has already spoken about them. duodenal and a gastroileostomy. So, I mean, I tried to do a voting. I had 50-50, but then most guys were of opinion for this one only. The image that is shown, a small loop present, 50 centimeter, that common loop, what you call it, but this would go in form of a biliopancreatic division. It's a surgery which is outdated actually, and nowadays it's more of a duodenal switch that is done. So in my opinion, it would have been a duodenal switch, but yeah, I mean, depending on the common loop size and then the kind of surgery that is done, the answers in this patient would be changed. Yes, Kishore, you have a point. So my suggestion would be that if you attend the sessions that I regularly take, the question solving sessions, you will get adapted to that kind of a pressure situation. Okay, Hirschsprung's is failure of migration of ganglion cells, intestinal obstruction postnatally makes sense. Proximal segment is constricted to galat ho jata hai na, and the non-coordinated paralysis. So he's saying which of the following is correct. So I think 1, 2, and 4 are correct in this case. Logically, we can work out the data. Proximal, kahin pe bhi rasta band hoga, I mean, ganglionosis, the proximal part of the gut will begin to dilate. Then is priority in triage, where anybody with airway obstruction is gonna be given up priority. Noisy breathing, grunting, there might be some problem with the airway of the patient. So this guy is, I mean, there's another guy with breathing difficulty that could be asthma or COPD, but especially with respect to grunting in an unconscious patient, airway compromise is what I am trying to highlight for 56. Then this image was again debated, but मतलब ऐसे ही कहते हैं आलू के जैसा था सर, ऐसे ना छोटा सा protuberant था. So if it's like a small like aloo, if I can say, or a small pear shaped dilation related to biliary tree, then has to be choledochal cyst only. Even if I don't know the history, and pancreatic divisum would be having like two different entries of two different, I mean, the pancreatic divisum, the ducts would be entering. So it's like small ducts are two different entries that would be seen. So I think even if I don't go into the history, the small cystic pearly pear-shaped dilation of the biliary pathway helps in identifying this as Mirizi, man. That's gonna be stone in the Hartmann pouch of the gallbladder, no? So that's gonna be a totally different ballgame, and the history for that would also be different. So don't get me started for Mirizi syndrome at the moment, man. It will totally change the whole perspective of this discussion. So I just put up an image for the pancreas divisum and the choledochal cyst as well. And then we have this patient who's having um, uh, extradural hemorrhage, very, very classical. I just want to bring to your attention that in EDH, we preferably do a craniotomy, not a craniectomy. क्रेनियक्टमी इज डन इन अ केस ऑफ मैलिग्नेंट सेरिब्रल एडिमा. जैसे किसी पेशेंट को स्ट्रोक हो गया और उसके बाद में लार्ज मल्टी लोबार स्ट्रोक हुआ, एमसीए का मेन ट्रंक ब्लॉक हुआ, द गाय एंडेड अप विद डेवलपमेंट ऑफ हेमर्जिक ट्रांसफॉर्मेशन ऑफ अ इश्केमिक स्ट्रोक. एंड लॉस्ट ऑफ टाइम व्हेन वी हैव अ हेमर्जिक ट्रांसफॉर्मेशन ऑफ इश्केमिक स्ट्रोक, इट कैन रिजल्ट इन डेवलपमेंट ऑफ अ मैलिग्नेंट सेरिब्रल एडिमा. तो वहाँ पे बोन को निकाल देते हैं एंड वी लेट द स्वेलिंग कम डाउन एंड द बोन विल बी केप्ट इन द पेरिटोनियल कैविटी ऑफ द पेशेंट. सो क्रेनियक्टमी एंड क्रेनियोटमी आर टू डिफरेंट थिंग्स. It was basically a burhole craniotomy. Craniotomy word was not given, but then what we do in this case is there's a midline shift that is present, which is why I'm justifying burhole for this case and not a decompressive hemicranectomy, which is done in cases of stroke where there is a hemorrhagic transformation of the ischemic stroke and then you have a malignant cerebral edema. So that's the logically that is present here. Yeah, hemicranectomy I can explain. No, malignant cerebral edema के लिए करते हैं ना craniotomy. Even I have reference of a surgeon from AIMS only. तो आप we let them fight and evaluate this. Burhole is the first answer for the decompression part. And if you're planning to do a hemicraniectomy, guys, that's for a malignant cerebral edema. That's what I have read for hemicraniectomy as well. Okay. The image for this one, yeah, I mean, doc, you cannot expect me to get you the exact image, right? Then is the steps for a hernioplasty. So they are arranged in the order itself for the convenience of discussion at the moment. Both that question related to, I mean, the hernioplasty one and the previous one where we are talking about a gallbladder dissection were arranged in a fashion that they were looking easier now, but I understand that in the actual paper it might have been a little difficult. Then is a case of acute appendicitis. For kids, we don't do a CT scan to avoid radiation exposure. So ultrasound makes sense. Ochsner-Sharon regime is used for conservative management in appendicular mass, not an abscess mass. But we don't do a appendicectomy in all cases. It's usually an interval appendicectomy. Is written propped appendicectomy, and in all cases, so like we may not be going ahead with surgery in this case. So yeah, I mean, that's Kishore, you have a valid point that if it was solvable, it was solvable in the very first 5 seconds only. And if it's not going to be solvable, then it's going to be going crazy. Then we have a diffuse osteoporosis in a patient with serum calcium being elevated. Initially, I thought this question is on the topic of multiple myeloma, but because the SAP in the patient was elevated, so that makes it a parathyroid adenoma, and a system scan would be done in this case. Then we come to the pathology component for Peutz-Jeghers, that arborizing pattern is present, STK11. So the remaining parts are wrong, autosomal dominant and the congenital retinal pigmentation part. So C and D are the most appropriate ones for the current part. Then is a question with respect to lymphadenopathy, mantle cell lymphoma. So mantle cell lymphoma, I think the question was related to pathogenesis. So if pathogenesis is there and you ask me a single best answer, I'll go with cyclin D. I checked with ma'am also. And if it is gonna be like, cyclin is not gonna be given, then the diagnostic aid would be SOX also. But single best answer is cyclin. Otherwise, I'm putting a small arrow to say where you have to select at least two. And then CD200 would be for chronic lymphocytic leukemia for the differentiation part. But then mantle cell lymphoma, there is a table that I've discussed in medicine also. If you listen to CLL, I mean, try listen to it half an hour, 2x पे सुनोगे 15 minutes में हो जाएगा. But that helps you analyze like whatever you studied. I mean, if you think that आपको CLL आता है, then just listen to my part in the main video part, and you'll get an idea regarding like what you may be lacking or you are good at. And both ways it is gonna be beneficial. Okay, G. What is true about Gaucher's disease? So beta glucocerebrosidase and crumpled tissue paper appearance makes sense there. Foamy cells are like atherosclerosis, so I'll not put them in the correct options for this particular question. So we'll go with the B and D for this one. Okay, G. Then steps of PCR, this you are good at, so I'll move ahead. I mean, this is what discussed in biochemistry, in pathology. I have cut down on the repetitions part, guys. You'll notice that all the questions that are repeated two times in different subjects, all those are not present in this particular PDF. I mean, in this document, they would not be present. I've tried to cut down on all those repetitions that is present. Okay, guys, then is combination which is correct regarding the stain. So pearl's blue would be bluish in color. I don't want to get into the rationale for these. It will take a longer time. So Jimsa mast cells purple is the correct answer for this one. And I mean, the logic you can work out for each one of these options subsequently. And you would have listened to the recalls of the various faculties as well. Rheumatic heart disease, I think two questions, pretty straightforward ones. Ashkoff body is caused by group A beta hemolytic streptococcus makes sense, but then only myocarditis, no pancarditis, and then mitral valve involvement is more than the aortic valve involvement. What I mean by rupture here is probably he meant that damage to the chordae tendineae. But anyway, the damage to the chordae tendineae of mitral valve operates at the highest hemodynamic stress in the body, which is why like the inferior two options do not make sense. Then is Menser insects and target cells present. So we'll go with hemoglobin electrophoresis in this case, especially because the target cell word was highlighted and then the Menser index mathematical value was also given in this case. True about retinoblastoma. So I think the two false statements are in front of you. The only game was inactive versus the active state for, I mean, RBA protein is like a bouncer in the club, no, that will prevent the development of a cancer. I mean, the bouncer in the club who in our body who will prevent development of a cancer. And then depending on the active or the inactive state, they would have played around with words. But yeah, I mean, the top two statements are totally wrong. And then the last statement is correct. And for C, I can say depending on active and inactive, we can like spend debating about it the whole day or the whole night and still not come to a conclusion. So I'm leaving it at that, whether it was active or the inactive state there. Okay. Yeah, only myocarditis. That's what I'm saying. No, doctor, only myocarditis. So that's the troublesome part there. Okay, G, fine. Boy with a karyotype related to chromosome 15. I mean, there were two possibilities here, Prader-Willi and Angelman. If obesity was given, Grelin part was described, we'll go with Prader-Willi. If it's gonna be a happy puppet, we'll go with Angelman syndrome. So most people, I think, in the recall spoke about some kind of obesity or weight gain in a person. So we'll go with option number A for this one. Then microcytic anemia, I mean, that looks like a joke here. The top three options are correct. Lipid is best visualized on a frozen section. Then is best describing the RAS gene. So I think there was one related to RB, the second one related to the RAS gene. This ma'am has described very well. So we'll go with option number A as she has said. Okay. Coming to the radiology part, like this kid is having fever, raised ESR, there is leukocytosis, and X-ray of the humerus is shown. And then he says like, what would you do in this case? what following is the next investigation to be done. So it can be like, what is the investigation choice, what is the next investigation. But like considering we are going with the next investigation, we'll go with like an MRI of the affected limb, and then subsequently we can decide whether we want to go ahead with any kind of a biopsy in the patient or not. But at the moment, like we'll go with the next investigation as MRI. Obviously, this is subjectable to debate, considering that if he says like, how do you confirm whether there's going to be some kind of a tumor versus an osteomyelitis, then obviously biopsy would be done. So we can obviously debate about it. Okay, tomorrow, man, at Gurgaon, Med PG. Since you were asking about the physical class, right? So tomorrow we are doing a live session in Gurgaon, and that would be Med PG. Okay, ji. Next one is purposeless involuntary jerks in a patient. So that would be Huntington's chorea. That purposeless jerks was making it easier. I don't need to describe the ventricles in a patient. I mean, दो ही सवाल होते हैं, synonyms पे आता है या फिर वो Huntington's पे होता है. And if MRI is given, then it has to be Huntington's chorea. Why 28? Because of anticipation, the disease can occur at a younger generation as well. Okay, ji. Then is a chronic smoker with the drooping of the, okay, so he gave that Horner syndrome wala presentation and he said what is to be done. So we had a good debate about it कि भाई MRI होगा, CT होगा. तो Horner के लिए तो we'll go with the I mean, we should go for an MRI, but now not in the option. So we'll go for the tissue diagnosis. That would be adenocarcinoma and the apex, which could be responsible for this. So we'll go with option number B for this one. Then is a patient with pneumothorax. Traditionally, he always gives a pneumothorax with the chest X-ray. This time, what was given was like a CT chest, and he'll say, "What will you do in this case?" So what we can do in this case is to, because there's a mediastinal shift, guys. I mean, if you look at it, the heart is literally compressed. It's literally sandwiched there. So considering that the heart is like literally compressed because of the air that is present at positive pressure, so we'll go with option number A. In fact, gold was also gold classification. We are going to talk about it very soon. Then is a guy with HIV, I think cough became productive and had hemoptysis. And I think this question did mention about HIV positive status as well. But the way it is like the manifestation, 3-month history in India for anybody, and then there's a hemoptysis, we will first think in terms of tuberculosis as a possibility. And then if it's ruled out, then we'll think in terms of a cancer in a patient. Then is the structure that is marked internal auditory canal, depending on the position of the arrow, or can be a vestibular aqueduct. So I'll rest it at that, depending on wherever the arrow was present. Nikita ma'am has described it beautifully. Then is statements regarding dronabinol. So आजकल पता है जो तुम्हारे gabapentin वाले patients हैं ना, lots of them, sciatica के जितने भी patients हैं, उनको सबको आप देखोगे most physicians would be writing dronabinol also because it is very good for pain relief. It's not FDA approved, it is an off-label usage, but आपके सारे sciatica वाले patients आजकल ना, they would be taking dronabinol. I mean, the only thing wrong in this case is option number C, and Ankit sir I think has already spoken about this one also. So we are sorted for 80th. 81st is rifampicin. I mean, giving ATT drugs with food would be something that is not a very good idea, and that would decrease the absorption of the drug. Remaining things make sense. RPO-B gene is like the first thing that we study about it. So option number D could be ruled out, but then A makes sense here. Then Vegaf, bevacizumab, and then ranibizumab. Then I think it was ramucirumab that came up in this question. So I think either of these are Ankit's notes only that I took the liberty of posting a picture of without taking his permission. But yeah, I mean, any of these drugs, if given in a question, would be the answer in a question. The way options are formulated, answer would be option number D. Okay, yeah, you're right, Kishore. Rifampicin is an exception, right? And then is regarding rimegepant. Rimegepant is used both in management of acute episodes of migraine and prevention of episodic migraine as well. So here he said, what is the true statement? So remaining are perfectly fine. I mean, it's safe for cardiac patients. It is safe in heart disease patients. So that's why the vasoconstriction part is wrong in this case. I mean, that's why we always say, that if somebody is having a coronary artery disease, peripheral arterial disease with presence of migraine, then we would be using Gepant like rimegepant in the patient. The correct answer here is option number C. Next is a standard question. I mean, FMG exam le lo, NEET PG le lo. They will always ask you about a guy cryptococcal antigen positive, and then you have to select for liposomal amphotericin B with 5-flucytosine. Beta adrenergic agonist, he's talking about salbutamol will cause a potassium influx redistribution, so it will cause a hyperkalemia. Option D, I think it was pulmonary vasodilation. So that is like not a side effect, it's just a manifestation that would be seen in this case. Okay, G. So 85 we have sorted. Then is a ATT drug having tingling and numbness in the lower limbs. So we read about linezolid, that B palm that whenever we study, linezolid can cause optic neuritis component. Again, SIRS notes also, I've just taken the liberty of putting snapshots there. That would be, I mean, the optic neuritis part and then subsequently the peripheral neuritis component as well. So 86 is sorted. This is the question that I was talking about, where like multiple description of channels were given and like which acts by marking the sodium potassium pump, that's gonna be digoxin. But yeah, the previous one that we spoke about was P glycoprotein. Then iris, I mean this I don't need to explain. इम्यून अब तो बोल बोल के मतलब बोर हो गए होगे आपने आइरिस को सुन के. So the only thing was increased dose of dolutegravir. Otherwise the iris part is like pretty easy for you to pick up in the question. Pulmonary artery hypertension, मतलब he has gone beyond asking about ambrisentan, bosentan. मुझे तो लग रहा था इलोप्रोस तक पूछेगा, उसके आगे पहुंच गए. सेलेक्सी पैक, दैट इज अ सिलेक्टिव प्रोस्टाग्लैंडिन I2, नाम ही है ना, सिलेक्सी, selective prostaglandin I2 receptor agonist. So it's gone a step ahead. We have a question in the app. Actually, I was just searching, so I came across this question, a beautiful one with respect to all the MOA part. And I would suggest PH ki tu jab bhi drugs hai na, they are always asked in the mechanism of action format. I mean, like that nowadays they don't get into that vasoreactivity test and will ask you, okay, which one would you use a vasoreactivity test is positive or negative, as we do in a medicine based question. Here he is straightforward, like ask you about the various um, drugs used in pulmonary artery hypertension from the MOA perspective. 89th is sorted. Then is a co-administered with ketoconazole. So the one which will be having interaction with cytochrome P450 is the one that we'll be talking about. That would be saxagliptin. I mean, two possibilities: Lina versus Saxa, liver, linagliptin metabolized from liver and Saxa also. Then considering the part where cytochrome P450 would not play a role, would be saxagliptin. Finrenon is one of the nephroprotective drugs in diabetic nephropathy. It reduces the incidence of increased cardiovascular mortality, so without causing significant drop in blood pressure. I mean, the beauty of the drug is 3 to 5 millimeter fall in systolic blood pressure, and therefore it reduces the afterload on the heart. So there are three correct statements except the C option, which looks to be wrong in this particular case. Yeah, analog would mean the same, man. The agonist I said no, the analog I said Shubham. So that is like the same thing, that we are on the same frequency. Okay, not an advantage of ketamine. So dissociative anesthesia is not an advantage, no, because like, बाकी सब तो ठीक है, मतलब, uh, tolerance to opioids and everything, but like causes dissociative anesthesia as a statement is okay. My only issue is that dissociative anesthesia is not a pleasant effect. आप देखे होंगे ना OT में वो पेशेंट गाली निकल रहा है, गंदी गंदी गालियां निकल रहा है, and you are like कि भाई क्या हो गया, क्या ketamine दिए थे, right? So lots of time I'm very sure, like if you worked in a hospital as an intern, as a resident, you would have seen a patient who's like a child, talking nonsense, adult person using choicest of abusers. That's under dissociative anesthesia. So 92 is option number C. Okay, orthopedics, that OK sign, that's anterior interosseous nerve. If not given, then we'll go with the median nerve in this case. Then is periosteal reaction in the X-ray. He says what is next investigation, then we go for MRI. If he says best investigation, we'll go for a biopsy in the patient. Then was anterior dislocation of the shoulder. वो दिखाई दे रहा है anterior dislocation है. Foosh was described, fall on the outstretched arm, and then there's gonna be like the position of the arm was also given. X-ray wise, it was easy pickup in the paper. Okay, cool. Moving on to 96, the answers are already given. I mean, the position of that, no, like the plan, like if I say equinus, then we'll go into the foot in the plantar flexion. So I don't need to do matching. It's already done. The correct answer for this one is option number A. And we move on to the PSM part. PSM part, ma'am has done the calculations very well. So I'm not getting into the calculations part. They're already present in the PDF. So the answer for this one is option number A. Then pollution is a big problem at the moment. AQI hitting 300 to 400. I mean, the alveoli में particles जा रहे हैं, and they can cause heart attack, they can cause stroke. In fact, the surprising thing they've said is air pollution is the #1 cause of stroke in India as of now. And a lot, I mean, the incidence is definitely increasing. So that's again a cause of concern as of now. a person who exercise, when you burn calories, then you will not eat junk now, because then you tend to realize that you worked on a treadmill. So you will tend to, avoid burgers, and you will try to do a bit of uh, healthy food. And when you take a healthy diet, then obviously it will be beneficial for the weight of the person as well. So confounder is the beneficial effect in this case. I mean, the synergistic effect of coming in. If you tend to exercise, then you tend to take care of your diet as well. Okay, a PDF will come. I think there would be a download link in the description of the video. It will come. If it is not there, it will come soon, because we had to just rush into this class at the moment. So subsequently, guys, you will get the entire PDF in a downloadable format, and you can scroll through this as much as you want. Okay, so the p-value was asked 3% probability. This is mathematics only. Then is not a component of Bradford-Hill's criteria for causation. Exclusion wise, that would be sensitivity. This was an interesting one, non-responder. No, normally we give hepatitis B immunoglobulin once, but in this guy, like, I mean, the guy is vulnerable. He has got a prick, so we will give 2 dosages of HBIG. That is a table from Neha ma'am's source that I have taken the liberty of discussing here. So 102 we are done. That would be option number B. Okay, then non-communicable disease. I mean, according to, if you just look at the data, right, even if you don't focus on anything else, mammography would not be available at a primary level. It would be only a breast self-examination. The remaining things would make sense at the moment. So 103 sorted. Then is role of family beyond reproduction. This was beyond me. I mean, if these general kind of questions are asked, then it's like anybody's guesses. But yeah, logically, if you work out and follow English, it can be solved out. Niti Aayog index, again, I'm leaving it to the PSM faculty. I have taken the answer directly from the PSM faculty for this one. I did not rack my brains at all about it. 2 subjects I have not tried to do any hard work is uh, one is biochemistry and second is the PSM domain. No disrespect, but like sometimes some subjects are always beyond some people's means. I'm like being honest, like, the 2 subjects that were always beyond me, and I had like a lot of trouble, and I mean, I had to work myself up to be able to read them, were the ones that I just mentioned. Okay, so this is piece of cake. This is what we see regularly. Even if you are like not into active practice, you will come across some relative, somebody sending you a picture saying fixed drug eruption. That's pretty straightforward with respect to a drug. So easy one to pick up there. Okay, then the most common site of melanoma would be hands and feet. Not syndromic management in males, lower abdominal pain. Remaining things make sense. I mean, urethral discharge, genital and inguinal swelling, but for lower abdominal pain, like the male partner would not be treated. That green cat and the yellow cat part is the one that is coming up here. Next was a question where I initially thought that it was intense itching, so it would be Candida. So I always were tempted to answer it as Candida. And then, like, there were a lot of things written, rete ridges, loss of rete ridges, and then abundant collagen, thinned out epithelium. So then I realized कि भाई इसमें गड़बड़ है भाई, कुछ तो गड़बड़ है. This is not a routine question. So then, because white was given, loss of rete ridges was given, so I changed that to lichen sclerosis, because lichen planus would be purple. कैंडिडा बनता नहीं, तो दो ही बनता है, वल्वर एंड ल्यूकोप्लेकिया वर्सेस lichen sclerosis. So considering that description given of like the dermatological description given by exclusion, B versus D, I took a wide guess. Luckily, it turned out to be correct. Okay. Uh, Next is match the following. This is already done. Carpet taxane for discoid lupus erythematosus, Darrier sign for cutaneous mastocytosis. So it's already sorted out for you at the moment. 110 down. Let's look at this one. The histological slide regarding stratum corneum. I mean, there are a lot of things which are given in a question, but then the final thing was regarding the virus, which would be responsible. And this would be, he's talking about human papilloma virus, so would be an oncogenic virus. Okay. The site where this injection was given, I could not pick up, like, I mean, another image apart from the one, though people said कि ये ऐसा नहीं था, but then this is the best one that I could mention for or pick it up for a greater palatine block. That is option number D. So I think 2, 3 from anesthesia, right? One was this nerve block. Second was that ketamine wala question that was given. And then, okay, so 2 only from anesthesia. One is the ketamine wala, and the second one is the nerve block that I have mentioned here. तो नहीं पेपर तो अलग अलग हैं यार. द माई पेपर वाज मच मोर सिंपलर. दिस इज मच मोर ट्रिकियर, एज यू कैन सी. Then is Krokenberg spindles, that would be for pigmentary glaucoma. Visual acuity in kids is Taller's chart and optokinetic nystagmus. This was multiple correct. Then is ये तो easy है, contact lens wearer with acanthamoeba, the radial keratoneuritis that is described. So calcofluor white stains would be the answer in this case. So we are sorted for 115. Okay, this one I had a bit of effort while trying to work because the person was having astigmatism also. There was like a lot of rubbing of eyes. So they could be like, an epithelial breach. And then I came across a bleb. So in the initial options, like I did not get this gas injection, C3F8 injection, but then one guy said C3F8 injection. So for taking care of that bleb, that tamponade effect of the gas can be used. Initially, I thought he's talking about SF6. So I was wondering, SF6 to bola nahi hai. Then he said C3F8 injection. So that's where I had to, retrospectively try and work out the data for this one. So option number D is the correct one, considering that we are having significant damage to the cornea, contributing to visual acuity being reduced to perception of light in this question. Yeah. Bubble being seen, but I think the bubble was not in the lens. No, it would be in the cornea of the patient. No, the bubble would not be in the lens. It will look like that, but the bubble would be present. I mean, that's what I'm saying. No, bleb or a bubble was present, but the bubble or the bleb was not in the lens. I think it was in the cornea of the patient. Okay, then is mid-dilated people. This is pretty straightforward, routine stuff. So I think out of 5 or 6 that we have just discussed in the previous couple of minutes, at least 3 are doable. The mid-dilated people is very classical for an acute angle closure glaucoma. So, okay, great, Kishore. You did a great job there. The medicine part, guys, I've already discussed, so मैं fast बोल देता हूँ. I mean, this is hypertrophic cardiomyopathy, so screen the family members. Implantable cardioverter defibrillator to be recommended. All BCD will cause a high output cardiac output failure. High salt intake will cause increase of peripheral resistance, which is why it is the answer. Then was drug-induced exogenous Cushing syndrome. For exogenous Cushing syndrome, we will not be doing a dexamethasone suppression test. These are done for determination of ectopic causes, or it is done for detection of endogenous causes, or it is done for autonomous causes. But for the exogenous component, it is A and B, which would be done in this case. Okay. वाल विद एन एरो, वो पुराना इमेज है, अभी वो गूगल पे मेरे को मिल नहीं रहा था, बट दैट्स द क्लासिकल इमेज दैट आई यूज्ड इन माय वर्जन 5 और वर्जन 6 वीडियोस. दैट क्लासिकल वो mitral valve पे ना, देयर इज अ forceps that is present. I remember that image is present in the database and they've been using it very, very extensively. Then Berrien rhythm would be anterior cerebral artery, but I could not find that word. Sometimes Google would not give you the image that you are actually looking for. I mean, I tried to search for it. Then is nephrotic syndrome. So proteinuria, hyperlipidemia, and hypoalbuminemia would be present. 3 options, right? Creatinine, minimal chain disease. So minimal chain disease, the serum creatinine of the patient would be normal. Then we don't have erythema nodosum. We don't have a short PR interval. The remaining 2 are perfectly right for Jones criteria, pretty standard questions. Rheumatic was very manageable this time. No hanky-panky business for how long would you give prophylaxis. For large P waves, I was having options between mitral stenosis, tricuspid stenosis. So we'll go with TS at the moment because I think there were 2 questions. One was A wave and second was for both of them, we'll go with tricuspid stenosis. Large A waves in JVP. Do comment whether there was large A wave present in the question or not. Quick marshal कर देना, large P wave था या large A wave था. The answer is tricuspid stenosis, but yes, I just want to check it out because earlier there was no TS coming up. So mitral stenosis, MSMR के बारे में ही हम लड़ रहे थे कि किस में होगा, right? So MS will cause pulmonary artery hypertension. So if it is P wave, then it is okay. So there is like only large P wave given. Okay, fine, sorted. But we'll still go by tricuspid stenosis. Then is that guy for like a long distance flight. Whenever I describe pulmonary embolism, I give 2 examples, Serena Williams and a long distance flight. Same case described here, long immobilization, smoking, OCP, all are risk factors, not is hypothyroidism. Continuous murmur would be a patent ductus arteriosus. This would be a subpulmonic murmur present. Was there an image of boot-shaped heart? I don't know. Was it as simple? Boot-shaped heart given in the paper. So I could not believe my ears, so I did not keep that question. Yeah, tall P wave is tricuspid stenosis, man, the right atrial enlargement component. Then here the cult mnemonic will come to your rescue. I always discuss cult versus Dr. Fuse. So we're not getting into the full form of it, but the cult would be starvation, diabetic ketoacidosis. Vomiting will cause a metabolic alkalosis. So that goes out of the window. Then drug not indicated in status epilepticus is ethosuximide. That would be useful for management of absence seizure. Okay. Fine. Then is diabetic ketoacidosis. Bicarb was 4. So it's a severe diabetic ketoacidosis. Potassium is normal, but we still need to give potassium now for the ongoing losses because patient would be having still vomiting. So vomiting would cause GI losses. And then there's a redistribution that would be happening as well. Right. So at the moment, the potassium is 4.8. That's okay. But then the person would have a redistribution. So we'll go with option number B here. Insulin infusion with potassium chloride 40 milligrams to be given. No role of soda bicarbonate, and ringer lactate is less preferred. So I've ruled out option number C and D because of the fluid aspect. Then there was a question on PrEP, not post exposure. So PrEP is going to be tenofovir and emtricitabine. There were doubts related to, sorry, is this the correct answer? Yes, I have a Harrison reference here for you for the PrEP part for tenofovir. That lecanopavir, that's the new drug, right? That's present on a lot of websites. But according to Harrison, it's tenofovir and emtricitabine in this case. Okay. देन नॉट सीन इन कॉन सिंड्रोम वुड बी हाइपरनाट्रीमिया, क्योंकि डाइल्यूशन हो जाती है ना, सोडियम जो होता है, सोडियम के साथ पानी भी तो आ रहा है ना, salt is also coming and the water is also coming. So because salt is also coming and water is also coming, dilution part will happen. That is why you will not be having hypernatremia. There are various versions going of this question. Metabolic acidosis, somebody saying hyperkalemia. No man, it was hypernatremia that was given, and hypernatremia is not a feature. Why? Because you would get a dilution. The snapshot from Harrison is given for this one. No image in PDF. Yeah, that's okay. I asked whether there was any mention of whether there was a description given, or whether there was any question related to tetralogy of Fallot. Okay, ji. Then according to the gold guidelines, I mean, this was a severe exacerbation in any respi question. If SpO2 is less than 90% at room air, this was 87%. Then we have to take it as severe. We will be giving antibiotics, we'll be giving steroids and nebulized bronchodilators. No role of antivirals in this case. The snapshot of the COPD guidelines. Do listen to the COPD video. I based it on the latest guidelines only in version PrepLadder X. And you can check out the COPD video there for like management, for how would you be handling it. The classes now for management would be A, B, and E only. Yep. Okay. Then is a patient for compressive myelopathy. For compressive myelopathy, he said which of the following would not be supporting the diagnosis. So normal superficial reflexes are also lost now. Superficial reflexes are lost in both lower motor as well as upper motor neuron lesions. So normal chemastic reflex will not support the diagnosis. Remaining findings can be at the level of the lesion, below the level of the lesion, but superficial reflexes are lost in both. Superficial reflexes are lost both in upper motor as well as lower motor neuron lesion. Okay, then was a question which I needed a lot of effort because this is not given in the routine guidelines, that what is the cutoff for clinically significant resting hypoxia. So I mean, when I say the word resting hypoxia, I mean that would mean very severe COPD. I think that is what he's trying to talk about. And very severe COPD would be when the FEV1 values would be less than 30%. I mean, whenever we correlate, no, very severe COPD would mean the guy would be restricted on a wheelchair, or maybe is trying to correlate with MMRC grade 4 where the person is restricted to a wheelchair. So there the FEV1 would be hitting very, very less. Okay. Okay, cool, fine. Which one? Compressive myelopathy? No, man. Compressive myelopathy is there. We had a great chat about it. So, yep, it was very much present. Fine, guys. Moving to the dengue question, I am having one with an accurate recall, one with a partial recall. This one is like 20,000 platelets. The guy is not having any evidence of any bleeding. So in this case, like we just need to give paracetamol to the patient. No aggressive interventions required for this guy. Yeah. Compressive myelopathy. Okay, guys, I'll keep it at the back of my mind. But I mean, if I had a question, I had to discuss it. Okay, so there's a man with alcoholic cirrhosis who's presented with confusion and 3 days of hematemesis. I mean, standard portal decompensated cirrhosis is what he's trying to say. And the guy's BP is 100/60. So propranolol would be used for prevention of bleeding, not in acute varicose bleeding. So this goes out. Spontaneous SBP can occur. So we will do a paracentesis. We can be giving antibiotics and octreotide to the patient. Albumin makes sense because hepatorenal syndrome is to be prevented. The question said what is not appropriate. So, I mean, propranolol is for non-bleeding varices and not for a bleeding varices in a patient. Yeah, it is FEV1 FVC ratio. That is a separate question that I think Doctor, okay, somebody just commented your last May I coming is 7991. So I'm coming to that question that you're saying, no, that ratio of FeV1 that you're talking about. So I think there were three questions on gold. Yeah, this is the one that you're talking about. That according to the gold classification, which of the following are correct? So this is like gold 1, this is gold 2, and then he's messed up with the data for 40% because there's like 30 to 14 and less than 30% here. So it is like 3 on gold that we discussed: severe exacerbation, the standard resting hypoxia that was coming up, or clinically significant hypoxia, whatever. And then is the one currently that is shown before you. So 3 for gold that I have discussed at the moment. Okay, ji. Then is a question on S. Sjögren syndrome. So there's a table, if you listen to S. Sjögren discussion that I've taken uh, RR, but yeah, Rumat is short in the main videos also. I think NEET PG is far away, so you can afford to do some topics from at least SLE or S Jogran तो आता ही है ना. SLE, S Jogran और scleroderma, तीन topic पढ़ना is not a big deal. So the table comes from there. What's gonna be used? So pause row antibody, Shermer's test, and then salivary gland biopsy, but not a scintigraphy. But scintigraphy से नहीं diagnosis होता, पुराने guidelines है. So we'll go with B, C, and D for this one. Then invasive pulmonary aspergillosis would be a febrile neutropenia as the most accurate association. This question could have been on orthopedics as well, Boutonniere deformity for rheumatoid arthritis. So we are at 141 mark at the moment. This is related to the occipital bone. We're talking about the first cervical vertebra. Then foramen ovale, I mean the markings were there for mandibular nerve, which would be controlling the muscles of mastication. So that's why the answer will turn out to be option number B. सिंगल बेस्ट आंसर यार होता नहीं है ना. एस जॉगरन का आंसर सिंगल बेस्ट कभी होता नहीं है, क्योंकि एस जॉगरन के लिए पूरा डायग्नोस्टिक क्राइटेरिया है ना यार. देखो पूरा क्राइटेरिया के बेसिस पे डायग्नोसिस होता है. यू नीड मल्टीपल थिंग्स फॉर डायग्नोसिस. इट कांट बी सिंगल बेस्ट. बट फिर भी आप बोलते हो तो आई से लाइक दिस लेबियल बायोप्सी, लाइक इन्वेस्टिगेशन ऑफ चॉइस इज ऑलवेज अ बायोप्सी. लाइक सिंगल बेस्ट आंसर अगर मुझसे बोलोगे तो दैट्स व्हाट आई ऑलवेज से फॉर एस जॉगरन. सिंगल बेस्ट आंसर इज सलाइवरी ग्लैंड बायोप्सी, दैट टू अ माइनर सलाइवरी ग्लैंड बायोप्सी और लेबियल बायोप्सी. ओके जी. Then is the positions here, inferior colliculus is understandable. Then is जो middle cerebral peduncle होता है, that would be little on the side. So it's just that trick was there, that the middle cerebral peduncle would be a little on the side, and the superior is unidentifiable, but then it is like SCP, then laterally the MCP, and then the inferior cerebellar peduncle. So you just have to align the orientation there for like the base of the brain or the brainstem. Okay, for this one, I could not get proper markings. We'll have to do more work on this. I mean, this is work for me only, but if you look at the data, I mean, there's an except question here. So tensor villi palatini would be related to, like, the soft palate, and I mean, the remaining ones would play a very critical role with respect to dysphagia, and I mean, the defect related to them can result in dysarthria as well. But yeah, I mean, if I go at the current face value, the most appropriate answer for 145 would be option number A. Then is a very interesting question, through which parts of the bones to the cranial nerves would pass through the cranial nerves pass to the CNS. The logic about this question is that which cranial nerve is a part of the central nervous system, which cranial nerve has meningeal covering, that is the optic nerve, right? It's the optic nerve that has that's an extension of the brain itself, and it's like a cranial nerve which is directly a part of the central nervous system. So the correct answer for this one would be the sphenoid bone. The logic here was, I mean, temporal, I understand. Temporal is also related to the facial nerve. So your question would be why? But then facial nerve is not considered to be a part of the central nervous system, whereas the the optic nerve is the only cranial nerve having a meningeal covering. That is why you can, check for papilledema in the optic disc as well. So the probable logic behind this question was that which cranial nerve is an extension of the central nervous system, which would help us identify this. No, cribriform plate I think is not in the images, and cribriform plate would not be called. So olfactory comparison, it's the optic which would be answered there, because I said that has proper meningeal coverings, and that's why like the most appropriate answer is the sphenoid primarily. Then is endocrine function. So we can see thyroid. इसमें एक layers बने हुए हैं ऐसे ऊपर नीचे वाले, तो glomerulosa, fasciculata, reticularis. So I'll place that as a adrenal gland, and then there are some certain areas which I can call as beta cells or island cells. So this looks to be the pancreas. लेकिन जो फर्स्ट वाला इमेज है उसमें तो follicles दिखाई दे रहे हैं, that is those germinal follicles. So this could be probably spleen, unlikely to be lymph node having such appearance. So I'll go with A as possibly a spleen, B as adrenal gland, C as the pancreas, D as that colloid wala thyroid gland. So I think if they match or they make sense, then at least we are partly at the right or sweet spot for being able to answer this question. Okay, ji. Muscle mastication related to opening of the mouth, and he says like which of the following statements is incorrect. Debated extensively the lateral pterygoid muscle attached to that condyloid process and not to the medial side of the rambus of the mandible. The remaining points make sense for 148. Okay, ji, which of the following is not associated with marked area? That pin mnemonic that they usually tell us, the only trick here is obturator externus written instead of internus. So you guys are anyway, the cat is already out of the bag and you guys have already gone through this part of the recall. So there was no point of me writing the entire mnemonic and explaining this there. Uterine endometrium. Okay. Okay, I was taking an FMG test and discussion just day before yesterday. So there I discussed those histology slides, no? So I was surprised that guys were messing up with that situation. I did not know it will come in the INI-CET paper also. But yeah, sometimes those slides can become tricky to be able to work out. Then is aortic or derivatives. This are like correctly matched at the moment. So I think it was either correctly matched or incorrectly matched that you had to figure up there. 150 down, guys. Then is a kid who is born at time the breathing difficulty resolves within 48 hours. So that would be TTNB, that is transient tachypnea of a newborn, because the breathing difficulty of the child is resolving on its own. The milestone that is matching is mature pincer grasp, so 1 साल पे आता है. So this would be transfer of objects at 6 months as an appropriate one. देन दिस रेशो नहीं, मुझे वैल्यू नहीं मिला इसका ना, बट सबने बोला कि सर शॉर्ट लोअर सेगमेंट था, तो फिर शॉर्ट लेग्स है, मेक डेट एज ए कॉन्ट्रोप्लेजिया. बट या इफ यू कैन कमेंट रिगार्डिंग दैट रेशो, सो दैट वुड बी ग्रेट, क्योंकि उस पर डिबेट नहीं करना, बस एक दो वैल्यूज लिख देना that are mentioned. Okay, 1.4. So fine. That's okay. If there are short legs present in a guy, वो circus वाला circus in a joker, so that makes it as एक 1.48 अब आ रहा है, वो 1.48 somebody was saying 1.1 or something. तो मैं इसलिए वैल्यू लिखा ही नहीं डर के मारे कि यार लड़ाई ना हो जाए. But good, like you have put in a data here, so I'll incorporate that. Okay, then is a kid with nephrotic syndrome, but then the biopsy is showing a segmental fibrosis and hyalinosis. So that tells me that this is not minimal chain disease. This would be focal segmental, that's at the corticomedullary junction. So we need to go for a renal biopsy, that would be at the corticomedullary junction. Okay. Next is a question with the pale stool. So obstructive jaundice in a baby, we always think in terms of biliary atresia. And then he says what is like the next investigation to be done. So we need to pick up that characteristic histopathological changes in the liver as well. Okay, 1:1. Yeah, I got it. This Kumar, that is 1:1.4. So we could pick that up. I was just worried about the mathematical ratios 1.1 or something like that. Discrepancies were coming. So 155 is sorted as option number D. Biochemistry, guys, the answers I marked out here. Chanu Guru Priya ma'am, she's done a tremendous job explaining them in a very short period of time. I did try to, work out the logic behind them, but then I've not written the logic for each one of these. So I'll just move down my slide for these biochemistry ones. The answers are marked out. As I said, when you scroll through the PDF subsequently, you would be in a good position to work out the information related to these. So I'm just fast forwarding the process here to the obs and gynae part. Okay. So for LSCS, the instruments part was given and you had to arrange the instruments that would be used. So pretty straightforward one for 169 as well. Okay. Then is this lady with the placenta previa. The fetal heart rate was pretty decent. So we'll be managing expectantly. We don't want to rush into a labor. The reference for the same from ma'am's notes is already given here. Endometrial thickness of 15. They always ask about endometrial. Every time we are having a perimenopausal woman, endometrial thickness going more than 12ish, then endometrial biopsy EB is usually done. So 171 also makes very plausible explanation. Then is atypical glandular cells in a 30-year-old woman. So again, colposcopy with endometrial sapling would be required. This was like whether the question is postpartum IUCD or was it like, subsequent one. So if it is postpartum, then I checked in the notes, it was like within 10 minutes. Post placental or postpartum were the words which I think were the only discrepancy that were present. Just took ma'am's notes, liberty of taking her notes without her permission, in fact, and showing it to you guys. So 173 is option number A for this particular case. And let's move to the next one. Not used to assess the ovarian reserve would be estradiol. The remaining part is like what the routine testing would be done. This came in FMG exam, guys. That Bakri balloon wala na, that patients, I mean, you have done the uterine massage and you are given the uterotonics and still the bleeding is occurring. So I think they're fixated on that process because that makes sense in the labor room. What step would you be doing? So like a lot of guys, they answered uterine artery embolization for FMG exam, I'm saying, but like, you know, that's like the last step or the last resort that you have to do. And in a labor room, that would not be possible there. या केम इन द एफएमजी एग्जाम. आई थिंक वर्डिंग्स भी बिल्कुल सेम है. उन्होंने मतलब कोशिश भी नहीं करी कि यार थोड़ा स्वैप मार देते, चेंज कर देते. देन द पीआईएच डेफिनेशन में पीडोलोडीमा भी नहीं आता ना. प्रोटीनूरिया तो है और हाइपरटेंशन भी है, एपिगैस्ट्रिक कंप्लेंट्स भी होती हैं, but then there would be no PIH complaints present. Then is the uterine version that would contribute to neurogenic shock. Understandably, those uterine ligaments, when they'll get stretched, that will contribute to development of neurogenic shock in a patient. Okay, guys, so we are hitting that window of talking about the ENT part. I think there's some part of my slides missing, but anyway. Apex of the cochlea is for low frequency and B base matlab bada matlab the base of the cochlea is for the higher frequency. I mean, whichever hack you want to remember it, base of base is big. So that way, like bada wala frequency would be option number B. Then was a carcinoma larynx, and then there was a lot of fixation part that I could pick up, you know, like this is full involvement of the vocal cords and vocal cord is fixed. Yeah, that's the word I was trying to look for. It's not spread to distant tissues, but if it's a fixed cord and local growth that is happening, so we would go for like T3 as the answer for this one. Not done with respect to an infant. This would be a pure-tone audiometry because obviously a baby cannot tell, so like that would be solved. And then for the FES part, it would be like the steps which are highlighted at the moment before you. So at the moment, guys, my count is 181. I've tried to remove all the revision, all the repeats which are present there. I still have about 7 to 8 more like in my kitty, but they were like without any options. So I did not I mean, I did not find it very comfortable to actually mention them here before you. But I think we are at a decent count at the moment. That gives you an idea regarding the number of marks that you would be getting approximately. I mean, obviously nobody would have attempted all the questions and nobody can do a 100% accurate recall, including that for the images as well. So this was a quick session, guys, where I tried to discuss the important highlights, and yeah, I mean, subsequently like the PDF of this might be available at the link in the description of the video, but at the moment, since we had to rush into this class and this discussion, so I thought I'll just update you on the kind of questions that had come. And yeah, sorry for talking a little faster, but I wanted to make it like quick recap of like putting a closure and a lid on whatever that has happened. And yeah, you can, you know, switch gears and keep on focusing on your studies for future. And for those of you who had issues with like solving MCQs, my suggestion is we regularly do these question sessions on the PrepLadder channel, not theory. Theory to underline karna aasan hota hai. We do question sessions on the PrepLadder channel on a regular basis. So that is, I think, the real match practice, you know, मतलब notes पढ़ना तो सभी पढ़ते हैं, right? But it's like the real cricket खेलना तो यही वाला है ना कि भी मैच खेल रहे हैं तो वहाँ 30 seconds में दिमाग क्लिक कर रहा है कि नहीं कर रहा है. That is of paramount importance. So we have put up references for these also. I mean, when in the PDF you'll get the ready reckoner reference as well. But yeah, I mean, this would be all from my side at this moment. And thank you so much, guys. I need to sit down and do calculations for safe range and everything. At the moment, I was busy in trying to work out the options, the most accurate ones for you guys, so that there is no dichotomy. You know, what I've tried to do is cut the noise and remove all kind of repeat questions. I've tried to repeat all kind of options which were not making sense there. So I think we are started for today, guys. Thank you so much for your patience and hearing me out. And yep, we'll be back with more interesting videos in future. Thank you, guys. Take care. Bye-bye.